Hi, my name is Alana Weatherly. I'm one of the PAs here at Florida Plastic Surgery Group, and today I will be discussing a breast surgery referred to as a breast lift with fat grafting, also known as a composite mastopexy. We offer this procedure here at our practice for patients who are looking to have their breasts lifted, so most often their nipple position is lower than they would like. So we reposition it at a correct height, and then we add fat to the areas to give it a more full look without the use of an implant. The fat is achieved from usually the belly, hips, or flanks. So it's going to be liposuction in the operating room. We process that fat sterilely and then inject it around the areas to give it a little bit more fuller look on the upper pole without adding an implant. So it's all your own natural tissue in addition to a breast lift. So typically when you come into our office, you'll have a consultation with the physician. At that point, you'll go over your surgical plan, your goals, post-operative expectations, where your surgery will be, and meet with a surgery scheduler if you decide to move forward. At the surgery center, where most of these procedures are done, it'll be an outpatient surgery, go home the same day. You'll be there all day, a few hours before, about an hour and a half for your surgery, and then a couple hours before you leave to go home. So at that point in time, you will need to have a driver that takes you to and from your surgery and stay with you the night, just because you will have been under anesthesia. At the end of your surgery, you'll have surgical tape similar to steri strips placed on all your incisions. And depending on where we get the fat from, most often, like I said, it's your belly, abdominal area. You'll have a surgical binder there to provide some gentle compression, as well as a surgical bra that you'll wear up until the time of your appointment. At your first appointment, we'll remove the steri strips, take a look at all the incisions, and ensure that everything is healing as we expect. You will continue wearing the sports bra, but we'll go over all that information with you at that first post-op appointment. And most often, we discontinue or tell you don't need to wear the abdominal binder anymore. After this procedure, it's very common to have an area of the breast that may be more swollen than the other. Slight asymmetries, meaning one side might look a little bit of a bulge where the fat grafting is still healing, or more bruising versus one breast than the other. We do expect that during the healing process. Sometimes the skin will even look tight or shiny. So those are all things you can expect for the first few weeks after the surgery, and usually that greatly decreases and everything settles out around week 3 to 4 following this surgery. Afterwards, we want to make sure that you're avoiding any physical activity or exercise for about 3 weeks from your procedure. But like I said, we'll go over the further post-op care at that first post-op appointment, where we'll also provide you with written instructions as well. After any surgery, there's certain things that we want you to do or maintain. So we want you to be up and around your house, moving about. So we want you to rest, but not bed rest. Normal daily activities are perfectly fine. Just avoid heavy lifting just because you had surgery on the breast. We also want to make sure you're ensuring that you're having enough hydration, so choosing good fluids, avoiding high caffeine drinks, energy drinks, alcoholic beverage while you're healing. Also making sure you're getting enough protein in your diet. That's going to help and be beneficial as well. After any surgery, we recommend that patients are not smoking. So that includes before surgery, after surgery as well. Smoking greatly decreases your body's ability to heal, and we don't want any of that while you're going through this entire process. There are certain red flag symptoms that we would want to know about, so it would warrant a phone call to our office. If you're experiencing fevers, nausea, vomiting, uncontrolled pain, excessive bleeding, if one breast is significantly larger than the other breast, chest pain, or any other worsening symptoms, please call our office at that time, and we'll triage your phone call, let you know if we need to bring you into our office any sooner, let you know if it's just a normal healing process, or further give you instructions or actions on what needs to be taken. Like I said, we're available here for you, so any questions, comments, or concerns, give us a call. Don't hesitate. We'd like to hear from you sooner than later. And thank you for choosing Florida Plastic Surgery Group.